first things to do, appropriate for staging, is to request a PET scan. I can't tell you how many people I know that have had early stage breast cancer diagnosed because there's a small tumor in their breast. And come to find out months later, after they had some severe back pain, they actually were dealing with metastatic breast cancer that had spread from the breast to distant organs, in this case, bone. So one of the most critical things to do from a staging perspective, and we'll get to this in a minute, but also in determining the type of surgery that you need, or if you need surgery, is getting that PET scan. So that will tell you if you're a candidate for surgery or if you need to approach it from a different route, quality of life versus curative intent. Something else that's really important as you look at your treatment options and your surgery options is what's called an Oncotype score. And Oncotype score is really based on your tumor pathology, and it determines this is how likely your cancer is to respond to chemo. So a certain score in that would say, okay, you're a good candidate for chemotherapy, you may want to delay the surgery, or you're a poor candidate for chemotherapy, we need to look at a different hormonal option or something of that nature. So Oncotype score is pretty typical nowadays. It wasn't so much when I was first diagnosed, it was just kind of coming to the forefront. But right now it's something that you should get consistently, so do ask your oncologist if they don't bring it up. Another thing that's super important is the pathology report. It's going to include things like, what is the grade of my cancer? Not stage, grade. It's on a scale from 1 to 3, and it determines how fast is my cancer dividing. So how quickly do I need to make a decision? Is it likely to come back again in the same breast tissue if I decide on a less aggressive breast conserving operation? So pathology is really going to indicate for us if we're dealing with the estrogen receptor positive breast cancer, estrogen receptor negative breast cancer, HER2 positive, which is a human growth protein. About 20% of breast cancers overexpress that protein, so there tend to be a lot more aggressive and a different treatment round that we would go through in that respect as well. And among the last things to think about is, where's the tumor located? If the breast cancer is behind the nipple, for example, you can't keep the nipple. This was the thing that first shocked me about my own diagnosis. I was mortified that I would lose my nipple. I couldn't fathom like what I would do with a tattooed on nipple. It just blew my mind. Eventually, I got used to that idea and decided on double mastectomy. But at first, or as a 26-year-old, it was something that I just couldn't comprehend. So if a tumor is close to your chest wall, for example, you're not going to be able to get a lumpectomy because you'd have to remove so much tissue around that to get clean margins. And margins are really just a circumference of non-cancerous tissue around a tumor. So if people think that they got it all, indicates that there's not going to be any sort of recurrence. That's not true. If you've watched my webinars for a while, you know that. But it is something that doctors try to get just to make sure that they've removed all remnants of the tumor, if not at a microscopic level. Among the most important thing to remember as you go through this type of procedure and this horrible news is you have time. You have time to make a decision. You don't have to get it out tomorrow. You don't have to get it out next week. It has been growing for a long time to get to a point where it's actually palpable or able to be felt. In my case, the tumor was growing for 10 years before it was the size of a peanut, so 1.7 centimeters, large enough for me to feel. So although the sense of urgency is certainly something I felt, I knew with some research that I did, it had taken a long time to get to that size. So I wanted to really take a step back and reflect on making the right decision, and just know that you don't have to make a decision